ये हमारे पास है left scapula. We determine the site by looking at the glenoid cavity, which points laterally, and the costal surface on the anterior side, which is concave, and the dorsal surface on the posterior side, which is convex. It has three borders: the superior border, the lateral border, the medial border. Three angles: the superior angle, the inferior angle, and the lateral angle. We have three processes: the spine of the scapula or the spinous process, the acromion process, the coracoid process. We have two surfaces. This is the costal surface on the anterior side and is concave. This is the dorsal surface on the posterior side and is convex. Coming onto the bony markings, on the costal surface we have three longitudinal ridges, and we have one long ridge on the lateral side, which is the longest ridge and is the thickest ridge. The function of this ridge is that it acts as a lever in the overhead abduction of the arm. On the dorsal surface, we have the spinous process, and this part is the supraspinous fossa. This part is the infraspinous fossa. And coming on to the muscle attachments, on the costal surface, we have this is the subscapular fossa, and the muscle attached over here is the subscapularis. And on the medial side, the muscle attached on the costal surface is the serratus anterior muscle. On the dorsal surface, the muscle attached to the supraspinous fossa is the supraspinatus muscle. Muscle attached on the infraspinous fossa is the infraspinatus muscle. This is the glenoid cavity. This is the supraglenoid tubercle. This is the infraglenoid tubercle. The muscle attached to the supraglenoid tubercle is the long head of biceps. Muscle attached to the infraglenoid tubercle is the long head of triceps. The muscle attached over here is present in two segments and is the teres minor muscle. And between the two segments of the teres minor muscle, the artery passing through is the circumflex artery. After that, we have the teres major muscle in the lower 2/3 part. On the inferior angle, on the dorsal surface, we have the latissimus dorsi muscle. Coming on to the medial border of the dorsal surface, on this part we have the levator scapulae muscle. Over here we have the rhomboid minor muscle, and over here in the lower 2/3 we have the rhomboid major muscle. If we are to describe the spine, this is the spinous process, and this is the crest of the spine. This is the upper lip, this is the lower lip. On the upper lip, there is the attachment of the trapezius muscle. On the lower lip, there is the attachment of the deltoid muscle. We have two notches on the scapula. This is the suprascapular notch, this. And between the glenoid cavity and the acromion process, this part is the spinoglenoid notch. This is the acromion process, and this contains a facet for the formation of the acromioclavicular joint. This is the coracoid process. Over here we have the attachment of the coracobrachialis and the short head of the bicep. After that, we have the attachment of the pectoralis minor muscle. After that, we have the attachment of the coracoclavicular ligament. Over here, right next to the suprascapular notch, we have the omohyoid muscle, and the ligament which acts as a bridge on the suprascapular notch is the transverse ligament. That's all.